You have seen those NCLEX skin questions that seem simple, color, rash, or trigger. But what if I tell you that they are not just really testing your knowledge of a skin at all? They are testing how you think, and let's break down what really happening. So in this video, since I always say part 3 for the NCLEX, this is a strategy how you will answer based on chapter 49, the assessment of integumentary function. So they talk about mostly like anatomy, overview of anatomy and physiology, but it's a little bit more advanced. Now I want to review just 3 minutes this chapter 49 before we go down furthermore on questions in case you don't looked on the previous part 1 and part 2. Part 1 it's a key terms, those fancy words that I barely can pronounce them. And then the outline is like very complicated because they go very in detail in assessment, diagnostic, age-related skin, and they go back and forth, even if they categorize like this. So now we give you an overview. You can see how those concepts connect. So the chapter covers everything from the structure and function of the integumentary system to how we assess, interpret, and care for patients with skin changes. So here in the introduction, we know the integumentary system includes the skin, hair, and nails. It's our body first line of defense. Think of it as a living shield that guards against injury, infection, and fluid loss. This also I said in immunity chapter. To the overview anatomy and physiology here, they talk about the skin has 3 layers, we know, epidermis, dermis, and subcutaneous tissue. And here the key term I challenge, if you, while I'm reading the list of the keywords, if you can identify the super duper cells that change our structure. So, and at the end of the chapter video of part 1 of terminology, I did already. I said my fancy pantsy cells, and give more little detail than while I was reading through them. So the hair helps reduce the heat loss and protects from the sun exposure, while the nails protects fingertips and contain hard keratin, and also while they grow, keeps also the dirt there. So that's why it's good to trim them all the time and have a little soft brush to clean. Oh yes, and remember that the 5 key function is protection, temperature, regulation, vitamin D, metabolism, sensation, and excretion. So remember those 5 key function here, the function. And this we talk also in these ones here. So 5 key functions. The assessment, the 3 here, you see here I have 4, 25 to 11 because it's divided in more That's why it's more the numbers here. This is just a little quick how it's structured. So the assessment, you start with patient history. Look for comorbidities, medication like corticosteroids that thin the skin, and the diet and environmental factors. Then perform the physical assessment, inspecting the color, moisture, integrity, vascular markers, and lesions. So tools like the Barden scale, so they talk here and then here and also here. Barden scale help identify pressure injury risk. And don't forget to assess hair and nails for conditions like alopecia or fungal changes. And it's not just that if you learned or not yet with endocrine, they have a problem with the hair loss, and the hair is just falling off. So, and also, you know, that the endocrine, like with thyroid, hypo and hyper, one has losing and another one makes it in different ways. So that's why it's really nice to know how those you know, like those diseases, how affect the hair and nails and skin itself. And for the age related skin changes, like every chapter they talk about age related skin change, but not skin, but age related, typical to that chapter. So in here we have, as we age, you know, the skin becomes thinner, less elastic, and heals very slowly. Older adults are prone to conditions like dermatoporosis, xerosis, eczema, psoriasis, and herpes zoster. I had actually somebody on herpes zoster in the skin. Right, we were in COVID, but kind of we were already in that period of taking vaccines, like a healthcare professional will get the vaccine. So in that time, my patient, one of my patient, um, came from hospital and just like had this herpes zoster because of decreased collagen and elastin, but it was so odd that this person just, she was isolated and now she has this, and the skin was very making her very uncomfortable. And because of the pain, she would not like the nurses and doctors because we're not gonna go that quick. The pain doesn't go, and then many more meds on top of what had that make that patient very unhappy. And we were like kind of in a lockdown, so we didn't have the luxury to go left and right to for this. And of course, when it's you need to know the contact precaution about this. The diagnostic studies. So we need to interpret the diagnostic findings, like lab studies, like CBC, albumin, urea, and cultures for bacterial or viral infection. Procedures like skin biopsy, keep in mind that, or tissue culturing to confirm diagnostics. Nurses use those results to evaluate healing, monitor pressure injuries, and guide the wound care plans. So by connecting this anatomy, function, and assessment and diagnostic, you'll understand not just the skin, how it looks like, but what it's telling you about the patient. So here I have this pretty type of skin lesion cheat sheet. You see it from NCLEXquiz.com. It's super nice. I just push in Google to give me skin. And while I was scrolling down, I saw this and I remember the NCLEXquiz.com I had printed in my past when I did the NCLEX, and it helped me. So thank you, NCLEXquiz.com. It helped me really nice back in a day. It's a very old website. Um, so you see, yeah. So I know like some of you say like, oh yeah, I know them. But when I was a student in a quiz, it was like, which of the following skin lesion? Yes. So now it comes the case study. A patient has some dots and kind of looks inflamed, kind of pus and red, and they're kind of a little bit spread. So, okay. So my classmates put this, but the correct answer was this. Because you see the similarity. Okay, it's red, red. Dots, dots. Here it looks inflamed. Yes. Then, but here's a pass, and here is a circular. So like one of the ones makes the difference. And another thing is like uh, every wound when you heal, you know what is treated. Like if you have like a bite from a tick, you know those how they looks like the skin gets inflamed, and also when you have varicella, all those mumps, the body will tell you like, oh my god, this is so unique, is this. So it's good to know, and the more you see it, I think the better. And of course you measure like across this and then this, and if it's elevated, then you try your best to measure the elevation, and if it's deep, you know, you need to do the depth. So I felt like this is cool to re-look. And of course the nails, like pale, like very fine anemia, the yellow, which is fungal, the lines here it's the myeloma. This is pitted nails. I never seen this in a patient. This I seen. This of course I seen. This I see. This I didn't see. This I didn't see, and this I didn't see. So, but if I see this, I will not remember. Now, when I was doing this investigation, I felt like, oh wow, I totally forgot about this. Because if you don't see as a nurse, even when you graduate, okay, if you are not exposed to so many patients, or even some, they don't have all of those. But in one day, when somebody shows up, 10 years later, you not remember all these little details. For skin, if you are a wound nurse, like a special wound nurse, yeah, I think by seeing so much skin issues, you know everything about it. But this, as a student, is good to know in the quiz when they give you like a small little scenario. Yes, and now more in the primary lesion and secondary lesion. See here how deep is. You will you'll measure this for the ulcer. But just to kind of, it's nice to have those charts to review a little bit. So like me, I always say like the NCLEX is broken in 15 specific areas. It's not just about knowing your content, it's just about knowing how you apply it to different situations. Those domains include the traditional 8 categories like management of care and psycho social adaptation, plus the 6 steps of clinical judgment, which is a huge focus of the new exam. So by organizing your notes around those 15 domains, I think you can learn how it plays them into the correct context. So here we have this person was very how to say very nice that let us know how NCLEX will give you those little domains, and here you have the definition and what challenge this person had. So this is a CPR, they call it a CPR, the candidate performance report after not passing, which is fine. I mean, it's sad when a candidate doesn't pass. Of course, it's sad, but it is okay. You know, it's okay. Um, um, it's sad. It's okay. So don't. I don't feel like I to cry over it too much, you know. But I know the proud of a nurse, like you study and now you go and you don't pass, you know, like it's sad. But I think it's like you need to know the specific areas. It's like um, you need to have a strategy. So that's why I want to share with you guys if this strategy works for you, if it's something newer that you were accustomed to. And like every exam, like one day my teacher said like, I don't know how you question me. So I did the office hours and I asked the teacher, the instructor, I don't know how to study this chapter and that chapter, because we never had like one chapter. We had like 5 chapters a week, and and it's impossible because you don't study just this. You have also leadership, also you have skills and labs, and learn the theory for what you have to when you go to the labs. Then you have a clinical rotation, and the clinical rotation is 2 full days, and then when to study, when to read. It's very hard for that. So and I asked and said like, why you ask me in here and not in there? I studied there and there. And says like, no, I think, and the instructor said, I think every student knows, but you need to pay attention when you read through the questions, because it's section of the chapter. So my instructor has a psychology, so I even was questioned, like essay questioned from a picture. I thought like, okay, I see this picture, okay, and I move on. And then that there were points, many points in that picture for the quiz. And I said, oh, fine, I know. So that's why I say it's a psychology here. So some instructors is like they they should know this pathophysiology. They should know this, because if you know the pathophysiology and the anatomy, then later you know how you implement, you know. So here is my famous pie. It's not mine, but it's from the NCLEX, the latest one when they publish. So these, it's a document with many pages. I have it down below in the description. It's in Google Drive, so it's a link directly there. You can download and look. But also you can go to the NCLEX here in the, and you'll get the, and you get this booklet to download for the RN or LVN. Um, so think about like, so I give you an example, like recognizing cues. You need to know like how the question is recognizing cues. Okay, I know this and seems okay, but actually it's like what clinical manifestation are observed in this patient. So that is a recognizing key. How do the clinical manifestation correlate to the underlying pathophysiology? So for skin, imagine this, like recognizing cues and analyzing cues. This is a very important. Like when you ask a patient, you do, and the patient comes in, and they don't come so often to a doctor office, so here and there for follow-ups, or maybe just one time a year. And as a home health nurse, maybe needs a home health nurse, and now sees a lot of issues with a patient, you know, because you take time to look and report later. Because many patients, they were not gonna go to the doctor, say like, oh, you know, doctor, 3 months ago I had this and that, and it hurt me, but I never told you about it. There are patients like this. I know so many stories, and how patient will avoid to say to a nurse or to a doctor some issues that we could save it now and not getting worsened later. So this is very important, like recognizing the cues and analyzing cues. The priority hypothesis is like what could happen if the patient's symptoms are not effectively managed. Generating solution, what treatments are included to manage the patient condition. taking action. What are the priority intervention for the patient? Evaluating outcomes. What findings demonstrate that the treatment plan is effective? Um, what follow-up data are needed? So, now I'm going. So my focus for today is like to show you recognizing cues and analyzing cues, mostly about the skin. Let's imagine NCLEX will ask you only from this chapter, and those 75 questions will be about skin. Well, the diseases and burns will be later, but let's say 1/3 will be from this chapter, and you have to say it's management of care, it's safety, it's health promotion, it's basic care, and because you need to make this pie and to complete with green light all in this area. So let's see how the skin works to pass the NCLEX. Because the clinical scenarios, it's very complicated when they give you those. And I have a friend that said had 6 scenarios in her NCLEX. 6. It's a lot, I think. 6 scenarios is a lot. So moving forward. Here it's the NCLEX domains and what to do, right? This is a key for nursing action, like use appropriate isolation if MRSA, impetigo, cellulitis with drainage, contact disseminated zoster, varicella for the airborne, plus contact localized zoster immunocompetent. So contact to cover the lesions. Clean wound before culture, swab base of lesion, PPE, and safe, sharp disposal. Verify tetanus and traumatic wounds. The red flag is like missing airborne plus contact, right? Touching base of vesicle without PPE, label culture without site, poor hand hygiene in dressing change. This with poor hand hygiene in dressing change, I think every nurse knows this, but the missing airborne plus contact that and the labeling culture and documentation. I said in outline about the documentation. I put a little paragraph there about documentation. And you see contact, airborne plus contact, tetanus booster if wound and more than 10 years. And management of care, this is like burden on admission, transfer at least each shift, and we know the numbers, implement prevention bundle every 2 hours turn. I think we know that. Float heals, moisture barrier support surveys, optimize nutrition hydration, the stages for pressure ulcers, timely photos, and sometimes when it's a skin, the doctor will like sometimes when they talk, I've seen this that don't want to use the fancy terms. If you say it's fine, but mostly they like to say, to describe how you see, picture it, you know. This was even before we had the fonts with to take a picture, you know, and we didn't have consent to do a picture. So you need to sit down and write how to draw a picture in words about this wound. Now it's easier, so you just say 2-3 words, take the picture and send to the doctor. Saves much more time. Before was a lot of to explain without a picture. That's why it says a picture, it's like 1,000 words. Calling stage 4, but also think sometimes people confuse stage 3 with stage 4. Oh yes, and now contracting a stage 2. No, you don't reverse stage in documentation. So never you do this. If a patient is admitted with stage 4, it will be stage 4 even until it's healed, until it's completely healed, and even if it gets smaller in size or even it's getting like almost to be healed, so that will be always that stage. And people say like, why? But now it's very tiny. It's not 5 centimeters. Now it's like just 0.5, like 0.5. But that means that is recognizing a cue and evaluate the outcome. That means whatever the treatment is done, nutrition, teaching, and all those steps you've been done. That means in this period of time, 3 months, 6 months, this stage of pressure ulcer on admission become tiny, tiny, tiny and healed. And in history, we'll say a patient had stage 4 on admission in January. Now in May is healed. So that's your evaluating cue. So that the burden turn every 2 hours. Then health promotion, teach sun safety. This especially when it's also when it's wind, because when it's wind and it's dry, some people get these herpes on their lips. So sometimes it's not good when it's wind. So it's better to have these sticks that you apply on the lips and have a little bit of medicated on it, because it will help the skin on the lips. Be careful on that. You see here on A, B, C, D, I talk a lot in the in outline. I think I'm talking a lot now instead of going into the practice questions. Assess body image, basic comfort, like everybody kind of has a problem here. Bathe with warm water, mild cleanse, apply emollient within 3 minutes, soak sealed, soft breathable fabrics, avoid fragrance, wool, short nails, cotton, gloves at night, hot shower, harsh soap, steroids after moisturizer. That it's wrong order. So pharmacological, they talk a lot about this type of meds here. topical steroids, and then yeah, antiviral window, the 72. Let's go into the next. Here it's the second part of the 15 domains. You see here protein, wounds for nutrition consult. I'm just looking what it's yeah, it says dark skin at mucosa, sclera, palms, texture. So be mindful of cultural and spiritual for the skin. Patient education needs like you'll see in some questions, but the patient education also is like when you educate the caregiver of a patient, or it says like the education is also when a nurse will intervene when the caregiver of a patient states this and that. So that means you teach a patient these steps, and then but the caregiver needs to follow for the patient to make sure the patient has the best care. Ethical photo documentation only with consent and secure storage. Nowadays, yes. Yeah, because this it's like a part so a photo it's their property, because in that photo contains that type of wound structure, so that means it's their property and needs to be secure. Yeah, okay. Here we get more like items ask you to do. So choose the correct team member for tasks. Like UAP, it's the caregiver turns every 2 hours. RN assess for bony prominence. And to avoid delegating skin assessment staging to a caregiver. But he says like, no, I'm RN, I don't do this. But sometimes when it's very busy, then you'll ask the caregiver or the CNA, so how the dressing looks like, how the tell me how the wound looks like when you reposition the patient or you went to the bathroom, you know. So you cannot document that unless you go and recheck it. It's good to know what they think, because you're gonna go and verify. So it's like, oh, okay, this it's good, or if it says like it's more redness than the caregiver said, then you say, when I looked, it was during my assessment, I found more complication that when you told me, either got drastic in this little period or you haven't seen. So it's kind of tricky here to kind of say, but choice of words is so hard nowadays. And here, like when to consult a wound ostomy nurse, palliative wound goals, informed consent, times out when it's the skin biopsy. Safety and infection control, you see isolation choices, specimen collection, heat and cold therapy for safety. Do not debride the stable dry heal a scar without infection. And here it says like ask you to do, place the correct precaution, collect culture before antibiotics every time. Here on the health promotion and maintenance, you see sun safety, monthly skin self-exam, and nutrition. All the adults, they need to go and check the skin, and they do a little biopsy to see that it's no cancerous, like exposed to a cancer issues. Body image, if apolacea, VT, LIGO, acne, it's like for adolescents more, but also later in life. Yeah, here is the other part of the pie. You see, high heels, what to watch for. So basic care and comfort. Bathing, the pH balance cleansers, pressure relief, incontinence care, barrier creams to avoid, oh yes, avoid double brief. There were somewhere in United States about double brief, and it was a scandal long time ago, but yeah, so that's why now it shows up this. Nail and foot care for diabetic precaution. Yeah, avoid hot water, harsh soap, pharmacological, again, topical steroids, antihistamine, antivirals for the zoster, antifungals, silver agents. Yeah, be meaningful here with the interaction and contradiction. Usually when it's about skin related, and when they ask you about medication, they will ask you about interaction and contradiction. In this area, it's one of probably this, and it's another one area of the Med-Surg when the NCLEX will ask you for interaction and contradiction. So this is the meds on here because it's very important with the skin. Because all the when you get an allergic reaction for immunity, then you'll see on skin. So they want to show that. Recognizing the red flags, pressure injuries, here device related pressure diagnostics. Here it's like stop the suspected causative drugs and notify provider stat. You know, like stage correctly. We talked about measure length, width, and depth, document, then protect skin under the devices. Then you teach post biopsy, pressure for 10 to 15 minutes, keep dry for 24 hours, report bleeding, infection. Then psychosocial adaptation, it's like systemic responses, cellulitis, sepsis, burns, not primary here, but thermal injuries basics. Yeah, because this is the chapter 49 in this unit. They talk about skin, and the next chapter is more about diseases, and then 51 it's about burns. So that's why they talk here. Acute urticaria, angioedema, airway threat, temperature, This regulation in older adults, adverse heat cold response. So always prioritize airway, trend virals and labs for infection. Stop cold heat with numbness, pallor, blistering, or severe pain. Yeah. So you see, delaying epi. Here, continuing topical exposure causing contact dermatitis without removing irritant. That might be a silly question, but you cannot pass because of this silly question. Finally, we are in the question. I put just 10 questions, and we have a lot of select all of the apply and this one. So an immobile febrile post-op patient has a Braden score of 11. Which nursing action are priority to reduce pressure injury risk? Oh my goodness, I've been talking for so long. Select all that apply. Reposition at least every 2 hours with the head of bed elevated when possible. Use pressure redistribution surface, like example high specification from a mattress. Massage redness bony prominences for 5 minutes every shift. Then we have keep skin clean, clean and dry. Apply a moisture barrier after each incontinence episode. Fluid limit to 1 liter a day to reduce edema. Float heels off the bed with pillows or heels devices. So reposition at least every 2 hours. Then use a pressure redistribution surface. Keep clean and dry. Apply a moisture barrier after each incontinence and float heels off the bed with pillows or heel devices. So the rational or low burden, it's a high risk. Intervention includes scheduled repositioning with minimal head of bed elevation, pressure redistribution surfaces, moisturizing continence management with barrier creams, and off-loading heels, massage over bony prominences, and fluid restriction are contradicted. Massage can damage ischemic tissue, and fluid restriction restriction on risk dehydration. Question 2, domain reduction of risk potential. You are assessing possible hypoxia and jaundice in a patient with darkly pigmented skin. Which sites are the most reliable? Conjunctival sac and sclera or yellowing, oral mucosa, nail beds, and conjunctiva for cyanosis. B. Palmar surfaces only for cyanosis, posterior neck for jaundice. Cheek for cyanosis, dorsum of hands for jaundice, hairline for cyanosis, tongue for jaundice only. It's a little bit odd, but conjunctival sac and sclera for yellowing, oral mucosa, nail beds, and conjunctiva for cyanosis. So in darker skin, assess mucous membranes for lips, tongue, conjunctiva, and nail band for cyanosis. Jaundice is best seen in the hard palate and sclera conjunctiva. Skin tone alone may mask color changes on cheeks or hand. Here about you see reduction of risk potential, match the integumentary finding with the primary and secondary lesion type. So think if in NCLEX will tell you, let's see if I can do this. I think it's that table and it's like this, and many like this. And they say you need to each whatever question it's here, you need to mark in those area if it's similar like here to match. But here we have like the skin, the primary or secondary. So this here. So either you check here or here, and here at the bottom will tell you like one per row, that means just one, or one or more, that means you have select all of the apply for this question into the question in the combination here, in the choices. So that it's like double in domains. So keep in mind when you put those dots, So here you have primary, and then you have secondary and secondary. Okay, so let's see. Match the integumentary findings where the primary or secondary lesion type. A. Vesicle, varicella, it's primary. Lichenification from chronic scratching. Then fissure at the corner of the mouth. Pumple, like the word, it's primary, crust over the impetigo lesion. The first is correct. Then fissure at the mouth, corner of the mouth, it's correct for the secondary. And pumple, the word, it's primary, and crossed over the impetigo lesion, it's secondary. So why this is not, I'll tell you now. So the rationale, the primary arise when previously skin, macule, pumple, nodule, vesicle, bulla, pustule, they are this. And then the secondary result from evolution, trauma to primary lesion, scale crust, lichenification, fissure, erosion, ulcer. So lichenification is secondary, not primary. Question 4, domain of management of care, risk reduction of risk potential. So now we have which patient findings warrant the most urgent referral for possible myeloma based on A, B, C, D, E criteria. A 0.4 centimetry symmetric tan molecule has been present since childhood. 1.2 centimeters irregular dark lesion with varying black brown color and evolving border on the back. Multiple skin colored pimple on the forehead consistent with Mila. 0.8 centimeter round cherry red pimple that blends when naked while shaving. So you see they talk, and now it's like most urgent referral for possible melanoma. So the correct answer is A, 1.2 centimeter irregular dark lesion with varying black-brown color. The rationale on A, B, C, D, E, asymmetry, border, irregularity, color, variegation, diameter, evolution, involving irregular, multicolored lesion is high risk. Long-standing symmetric molecule are typically nervy, Mila and cherry angiomas are benign. Question 5. Domain safety and infection control and pharmacological and parental therapies, because when you do the PI, sometimes there are two domains in one question, so they want to, how you say, shoot two rabbits in one. So here we have the rabbit with one thing to catch, right? So a patient with a painful unilateral vesicular rash in a dermatomal pattern is admitted with suspected herpes zoster, which is shingles. Which action are appropriate? Of course, select all of the apply because we have multiple here. So place the patient in airborne and contact isolation until lesion crossed over if disseminated or immunocompromised. I said in earlier in the 15 domains what to avoid, what they ask. So this is one of kind of it's asking, or quizzes or finals. It's typical. Then assign care to staff with documented varicella immunity. Avoid assessing to pregnant staff without immunity. The breed intact vesicle to reduce viral load. Assess for the posterpetic neuro and treat pain proactively. Apply a topical antibiotic to all lesions as prophylaxis. So the question is, make it obvious, it's place the patient in airborne and contact. And assign care to staff with documented varicella immunity. Then assess for posterpetic neuralgia and treat pain proactively. And we know the zoster is contagious via airborne contact when it's here. Question 6. Domain reduction of risk potential, pharmacological and parental therapies. Again, it's one question with two domains. The nurse reinforces teaching, but I think reinforcing teaching after a punch biopsy of a suspicious small on the cloth. Which statement indicates a correct understanding? A. I will keep the site clean and dry. We talked about how we teach a patient. Change the dressing daily and report redness, swallowing, or pus. I will soak the site in a warm bath tonight to reduce pain. I said what we do about this. I will the biopsy, because this is a biopsy. I said few things about the biopsy earlier. I should remove the steady strip tomorrow to let it out, let it air out. Aspirin is safety for pain because it thins the blood. So the correct answer is A. I will keep the site clean and dry, change dressing daily, and reports redness, swallowing, and pus. So post biopsy care, it's always gentle cleansing, keep dressing dry, watch for infection, avoid soaking, keep adhesive strips until they fall off, and avoid NSAIDs, aspirin that can increase bleeding unless prescribed. Here, remember I said like with pharmacological skin, it's one of the areas where NCLEX will ask you for contraindicated and specific meds. So you need to know the contraindication of NSAIDs and aspirin. It's a contradiction to have when you just got here, unless you see, unless it's prescribed, it's mandatory. But one day miss those, I think it's not the issue. So this was question 6. We have 4 more to go. Question 7, domain health promotion and maintenance. A patient had cryosurgery for an actinic keratosis. Which following should the nurse instruct the patient to expect versus report? And here again, this might be that type of question when the NCLEX, you have a table and you have to click like, yes, this is expecting, this is to report, this is expecting and follow up or something like this. Expect blister formation within 24 hours and mild serous drainage. So sounds good. Report formation of dry black scar within 2 hours. Report mild redness and swallowing around the site. Expect fever and malaise for 48 hours. Expect blister and formation within 24 hours. So after aerotherapy, transient pain, erythema, edema, and blister that later crossed are expected. Fever, systemic symptoms, or rapidly spreading redness suggest infection. Black scar in 2 hours is not typical. Mild local redness is expected, not report worthy unless worsening. So you see here he said expect, report, that is like true or false. So we said instead of saying true or false, we said report, and expect here. So it's a little bit tricky, but question 8, domain safety and infection control, basic care and comfort. Again, select of all the apply. Select all the apply. We have use silicone base Oh, an older adult on a chronic corticosteroids has fragile paper-thin skin dermatoporosis, which action best prevents skin injury. Use silicone-based adhesive dressing or paper tape. Support skin during removal. Lift, don't slide the patient during repositioning. Use draw sheets. Apply hot packs directly on the bony prominences to improve perfusion. Moisturize skin daily and maintain adequate protein hydration. Remove adhesive dressing quickly to reduce discomfort. Oh my god, I have to say so much about each of them. Use silicone-based adhesive dressing or paper tapes to support skin during removal. Lift, don't slide. Moisturize daily, maintain protein and hydration, because here is the age-related complication, right? Fragile age skin tear easily. So this is one of the complication I talked in outline. They have a fragile skin. Use gentle adhesives. I said this like for 10 times already. And careful removal. Avoid shear with lift devices. Maintain moisturization and nutrition. Again, many times I said. Never place hot packs on bony. You see, never on bony promises. Remove adhesive slowly while repositioning the skin. So now we are in question 9. Domain, again, domain health promotion and maintenance, reduction of risk potential. Again, we have the select all of apply. So we want the two rabbits in one one. I cannot say. Which statements about sweat glands are correct? Endocrine glands are widely distributed and help with thermoregulation via watery sweat. B. Apocrine glands open directly to skin surface where on the body apocrine secretion in axillae and groin are odorless until acted on by skin bacteria. Eccrine glands are concentrated in axilla and perineum. So this I said a little bit on key terminology about those. So there it's a short definition what really are. So endocrine are widely distributed and help with thermoregulation. And apocrine secretion in axilla and groin are odorless until acted on skin bacteria. So here are the endocrine glands. They are spread in forehead, palms, and sole and cool the body. In the other side, the apocrine glands are the hair-bearing areas, and their secretion become odorous after bacterial. Do not open widely to surface everywhere, and the eccrine glands are not limited to axilla or perineum. On question 10, we have domain management of care and reduction of risk potential. Which documentation best best reflects an accurate integumentary assessment of foliation. Small sore on leg looks infected. 1.0 centimetry with 0.8 centimetry oval. Erythematous scaly plaque with well demarcated borders on right anterior shin. Scant serous exudate present. Red rash on arm, probably allergic, or the dark mole on the back. Watch for now. So this is very well good documentation because you have an idea how it looks like. So highly quality documentation includes in size, shape, color, morphology, borders, exudate, and precise location without interpretation, diagnosis, language. So that's it, 10 questions with a mix and match of multiple domains, those 15 from this chapter, and I think you will know now how to answer those domains, and I hope it made a bit a bit clear to understand. See you in more in the chapter 50. Bye for now.
We finally made it!
Thank you again for your time and trust. I'm Melania, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.